All right, welcome back. Male circumcision is performed as a rite of passage from childhood to manhood among young men by various cultural groups and is an important component of the cultural landscape of the country protected by the South African Constitution. Despite its traditional importance, male circumcision continues to generate public outcry, with the Eastern Cape recording the highest number of initiate deaths and injuries currently. So to assist us in our discussion this morning on traditional initiation schools and to help us understand if traditional circumcision has lost its respect and credibility, we have from the Department of Health's Director for Medical Male Circumcision, Collen, Bonnecwe. Good to have you. Thank you very much for being our guest on the program. From our Umtata studios, we are joined by the director of the Man and Boy Foundation, Nkululeko Nxesi. Thank you very much, Nkululeko. It's great to have you on the program.
Thank you. Morning.
And then in Durban, the Inkosi Sipho Mahlangu, the chairperson of the National House of Traditional Leaders, also a guest. Thank you very much for coming, sir.
Good morning, thank you.
Nkosi Mahlangu, let me begin with you. Male circumcision, using traditional methods, has been regarded by some as a dangerous, perhaps even life-threatening rite of passage. Are we letting our young men and boys down by continuing with the practice, or should we not worry about their lives first?
Look, Glenn, we are not necessarily letting the boys down. I think initiation is an age-old cultural practice that our African communities still believe in. And we have done a lot over years to try and correct the illegal practices that some of our people, because of hunger and other challenges, that they've decided to take advantage of a lack of support to the institution of traditional leadership. I think it is only, in the past 5 or 6 years where the institution has taken back this issue of initiation, because we are the custodians of culture, and government is slowly also coming into play in terms of supporting us as a sector to be able to do this. Every year, this culture is growing each and every year. Just last year, we had about approximately 100,000 boys that went to initiation schools. And I would believe that government and those that are budgeting, they need to do more to make sure that the Department of Cooperative Governance is given enough funds for us to be able to do our work as traditional leaders.
Yeah. Nkosi, I'm going to carry on with you just to ask you another question. If we look at the Eastern Cape's circumcision legislation, it sets the legal age for circumcision at 18 years old, if I'm correct. But recently at some initiation schools in the Eastern Cape, it was found that over 60 initiatives were underage. Surely this is unacceptable. I was reading a story of a 6-year-old that was actually taken to an initiation school. What are your views on this? And what have you seen happening over the years, and what is the National House of Traditional Leaders been doing to curb the botched circumcisions and illegal schools?
We've done quite a lot. We've set up your coordinating committees within that are monitoring the initiation practice. We've also assisted in terms of making sure that provinces adhere to the age. If you look at what is happening in Limpopo, all traditional leaders are participating in making sure that they monitor what happens within the initiation schools. You look at what is happening in Mpumalanga, traditional leaders are playing a big role. We've infused even the medical assistance within the practice, so we've modernized it in other provinces as the institution, and working very hard to make sure that even the Eastern Cape also follows suit in terms of making sure that the medical fraternity plays an important role. We've drawn the police, we've drawn the National Prosecutions Authority, so that all those that are doing illegal things should be arrested. So there is a lot that we are doing. We are on the ground whenever there is initiation, and I think we still believe that one death is one death too many, even though the numbers have been decreasing because of the intervention that we've made. If you look back at what happened in 2013, I mean, almost 120 boys were lost in that year. And the numbers have been coming down because of traditional leaders and the National House and the Department of Health and other departments
what
that
are we
stood up and said enough is enough, working with NGOs. Yes.
I'm going to bring the Department of Health into the conversation now. Collen, again, thank you very much for being with us. But if we look from the Department of Health's figures, what are we looking at? Are we saying that the death toll is going down? So 2013, we had 120. How was last year? What were the figures like last year? And I'm talking deaths. Unfortunately, highlighting deaths, because I think that's what we're trying to get to the bottom of, is how we protect the young men of South Africa.
Thank you, Len. No, definitely there is a decrease, there is a decline.
Yeah.
Over the last 5 years, we are seeing the numbers going down. Specifically in Eastern Cape, if I could give example, 4 years ago, we were talking about 48, 49. A year thereafter, coming to 46, 43. The last year, we were as far down as 15 deaths.
15
15.
deaths.
Mm.
So that's the numbers we're setting at. However, when you look at some other figures, we're seeing, and this is from the Department of Traditional Affairs releasing, that saying over the last, 2006, I mean, we talk deaths, but let's talk about amputations of penises due to botched circumcisions. So it's not only deaths, it's also things that go wrong. Those things have to be taken into consideration, and also the suicides that result after that. That's a major concern. Collen, if you'd like to...
No, that is quite true. But maybe if you could allow me to kind of maybe indicate as to what the exact role of the Department of Health is in this space. We are coming in more from the entry point of support. The space really belongs to COCTA, as well as traditional leaders.
Yeah.
Now, we have in partnership with the traditional leaders as well as the Department of COCTA, the partnership which is really around the delivery of key main things, which remain to be the main elements in the MMC, because from the Department of Health we're providing MMC. These 4 things are health screening of the initiates. Secondly, voluntary HIV counseling and testing. Number 3 is about factoring in health standards, issues of cross-infections, issues of how to care for the boys in terms of hygiene and so on. And lastly, which is very, very important, is the total removal of the foreskin. Those are the pillars of MMC. And in this partnership, we seeking to be inculcating those 4 things into that space.
Yeah.
We're working with the traditional leaders, we're working with the communities. We have a project which is quite a special ministerial project that is focusing mainly in the communities around issues of awareness and so on. So the health screening component helps us or assists us to determine the health status of the initiate prior to going into the school.
Yeah.
Because then we are excluding.
But it's not compulsory, is it, for them to have a health screening before they go into the schools?
From this partnership, it is, I would say it is almost compulsory, but it is not, we are not as successful as that.
But it's not being practiced.
Because compliance is questionable.
I want to bring Nkululeko now into the conversation, because I think Nkululeko has got a lot of hands-on experience. His foundation works a lot with the young boys that do go into this and the young men. Nkululeko, from your foundation's perspective, what is your viewpoint now when it comes to the protection of these young men that undergo traditional initiation? Should the policy be changed? How do we protect them?
No, thanks very much, Len. I think for starters, there is nothing wrong with the traditional initiation practice, because it's part of culture, and many boys and they do benefit out of this. But the challenge that the culture is, this practice is facing, is the issue of illegal traditional initiation schools and underage. Because even all the 7 boys that have died in Eastern Cape as we speak, the majority of them are underage, and we know the driving factors of the issue of underage. That one of those is the issue of the peer pressure. Now there are interventions that have been put in place to try to address these issues. One of those is to educate young boys and do awareness around the Traditional Initiation Act that has been placed in Eastern Cape, which stipulates the issue of the age. But also the issue of the illegal traditional nurses and traditional surgeons is an issue that we need to focus on. What will help us to deal with this issue is when the government, all government departments come and partake in this and put resources, as Nkosi Mahlangu has said. The problem is that government is not putting enough resources into this problem. They just think that this problem is going to go away. Yeah. And this problem is not going to go away, because even if you try to say, let the communities stop traditional initiation and opt for another method, which is medical male circumcision, that is not going to happen, because this practice is highly entrenched in our societies. So the government must begin to wake up and realize that unless they put resources and they commit themselves meaningfully, this problem
is going to carry on. It's going to carry
on.
The
other issue that I wanted to raise quickly is the issue of the medical male circumcision. Yes, we do support medical male circumcision as a choice for those people who want to undertake that particular service. But we are calling for government to make sure that they think very carefully when they are trying to integrate this, particularly in provinces like Eastern Cape, because already now we see that there is in some instances the correlationship between the deaths of initiates and how the medical male circumcision has been implemented in Eastern Cape. A number of boys, they are being kidnapped from schools and from homes to be circumcised by these NGOs that are doing medical male circumcision. During the initiation period, these boys, because of stigma that they face in the communities, they go back to initiation schools, they subject themselves to be recircumcised. We have reported this thing to government, and we're in pains in saying, unless the MMC is done in a proper way, many kids are going to die. Why government thinks is helping by providing MMC, which is provided by white-led NGOs in Eastern Cape, actually is creating more harms than good. That's one of the issues that we need to deal with, over and above other issues, which is to enhance awareness campaigns and to ensure that people that are perpetrators are arrested. We have developed rescue centers that are working quite well, but the problem is that we are not supported even financially to run with these, with these rescue centers.
Lastly, very quickly, please. We don't have time. Carry on. Okay, Nkululeko, I'm going to leave it there just for now. We'll hopefully get a closing word from you. But Nkosi Mahlangu, if we can sort of have a look at the CRL report that was released, and we see that, and which we had on the screen a little bit earlier, reporting on the recurring numbers of hospital admissions of initiates, missing minors, deaths, injuries, penile amputations, other related challenges in the past couple of years during the initiation seasons. These are the realities. The recommendations from the report, have they been implemented?
Yes, the recommendations from the report are being implemented. If you look at what is happening in Gauteng, the CRL recommended that there should not be initiation schools that are taking place in Gauteng, and we are working very closely with them to make sure that that happens. If you look at other provinces, the issue of MMC is handled very well, where you find that your traditional surgeons and your medical doctors are working hand in glove, of which is something that we're hoping that will take to other provinces. And I think it's also part of what the CRL is also proposing. If you look at the amputations, almost 98% of them, if not all of them, are happening in the Eastern Cape, where you have individualized male nurses. And we are saying maybe we need to look at these male nurses, and see what is it that we can do. And also the fact that when it comes to medical screening, some of our traditional surgeons can't analyze the medical report that is supposed to be used as a tool to guide them on whether they should perform the surgery or not.
Yeah,
so those are some of the challenges that we have, and we believe that if we work closer, we get more support to be able to monitor the issue of compliance as traditional leaders, and we have parents that are also assisting us, because the biggest challenge, it is parents in the Eastern Cape that do not necessarily want the assistance of the coordinating committees and the Department of Health to be able to intervene when there are problems. And I think
that's a good part.
Maybe the police could work a bit harder on that.
Okay, and Collen, it's a good part to bring you in as well when it comes to exactly what Nkosi was saying in terms of medical personnel, more training, helping them out. But I mean, surely, do you have enough resources to do something like that? Are you assisting as much as you can, or can you do more?
Certainly, Leon. Since, in 2013, Minister urged communities as well as traditional leaders. And through this partnership that we have with COCTA as well as Contralesa, the department offered to cover the expenses for medical doctors who themselves are sons from those communities, and they themselves are graduates of the tradition and approved by the traditional leadership. That is what is happening. Limpopo, Mpumalanga, those are two provinces which are leading in terms of that example.
Yes.
We're having a lot of doctors involved there. And of course, to a large extent, that helps to minimize the rate of adverse events, complications, and so on.
And we see that Limpopo has got the lowest death rate. Unfortunately, the Eastern Cape the highest, and that's where the big problems come in. We have to wrap this up, but one of the biggest things, and I think I'm going to have to give this one to Nkululeko as a final closing, and Nkululeko, I ask you to be quite quick on this, but a lot of people saying, why can't we just go the professional route? Do it under medical supervision. Why is it that that you have to go up into the mountain to do something like this? Take this culture and yet make it go through the professional means of a trained medical professional. How do you feel about that?
I think we are living in a democratic South Africa where the constitution allow people to practice their cultural, their cultural activities, and the government has a responsibility to assist and to ensure that those people, those indigenous communities who believe in certain cultural practices, they do those in a safer manner. And I think if the problem is mainly in Eastern Cape, what is important is that we must find a solution based on the dynamics of the province where the problem is. You can't take a solution of another problem and then impose it on another province. What is clear here is that we've got evidence of what is happening. We know what are the problems. We know what are the potential solutions. The problem is that we are not working in collaboration, and it seems as if government is not putting enough resources to address the issues that they need to be addressed, and hoping that if this problem continues, they will bring another solution which is not compatible with the communities on the ground. Okay. I think that if government can begin to listen to the challenges from the people of Eastern Cape, solutions will be found quickly. And I think we are trying to be going through a right direction. But the problem is that we want to impose foreign interventions instead of taking solutions from the people themselves.
All right, gentlemen, we unfortunately have run out of time. Thank you so much for talking to us here on the program, Circumcision Under the Spotlight. And we, of course, have got lots of your views, which we'll be reading your tweets in a short while as well. Let's quickly get into our news at 8. I hand